So we're trying to find somebody who can be taken along with him to our referral hospital, who will be giving some bedside care and attention to him. Because the mother that is the mother that we've been, we've been knowing her for the past 10 years as a psychic patient. So that's the problem we're facing. So this morning we're trying to see how best we can resolve it and make the referral. We tried to contact our hospital yesterday for the matron to see if we could get one of the janitors could be a volunteer to take care of him, so we could give him some token. But unfortunately, communication couldn't go through. So we are going to meet this morning and make a call and make sure that he can be taken. But the problem is that we don't want the mother to take him. She's wanting to take him away. She's being convinced that the child has been sick due to spiritual reason, that they have bewitched her child. So even last night we spent the whole night here around so that she came about 4 times trying to sneak the boy away. And
so she would like to use, she's trying to use bush medicine spiritual medicine.
Spiritual. They had some
because she's thinking maybe he's possessed or has some kind of curse or something.
In fact, the story she has given us, the story she has given us is that the neighborhood they live in is not a safe neighborhood for she and her children. Right, so we're even thinking on maybe making a home exchange, finding somebody who can go to her home and take her to another home. You see, but these all shall be, and these two, like we say, the problem here are resources. Because unemployment rate is like 98 to 99% in the community, and like for example, she's not working. She have a psychic problem. She have no immediate relatives. That's the problem most of the people face in the community here. So the clinic have been here for the past 10 to 13 years, but there's a break between the year 2000 and 2002, because there was a time that United Nations made a resolution that collectively there's no more financial support for Liberian refugees. So within the closure of that time, we Liberians ourselves in the community went around lobbying assistance from philanthropic and church organization. It was then we got to contact the Apankale Hospital, and they said they would come to our sympathy. So we Liberian staff running the clinic were trained in Liberia and migrated here during the crisis. We were taken to Apan for one more orientation and sent here to run the clinic. But prior to that, I was working with the United Nations Healthcare Delivery Program when the clinic was first opened. I was the medical assistant in charge, and I took care of a medical program for repatriation of those who wanted to go home. This is minute. And the same goes for Apam Hospital too. Every month they got a charity statistics. So because you cannot see a refugee in a dying condition and say you won't treat him. Though the incentives here are given moderately, but still they can't afford. You see, In fact, because of the incentive being very moderate, the nearby villagers come to enjoy the facilities. Because if they go to other clinics, they pay more. So down in April, Project Africa. Yeah, Henry.
I've heard of it. You should talk if maybe he's coming in April.
Yeah, we are praying. The email says, if America doesn't strike Iraq, then we will come. So we're praying for America.
Yeah. Why don't you give me the email? Maybe I can work with them.
Okay.
Maybe I can get some things to them before they come.
Okay.
Is this getting any better, or how would?
So instead of our population dropping, it's always escalating. You see, this is just a survey we did of some problem, case condition in the community, some statistics. Debilitating children too. You see. So and once the population grows, the problem grows too.
Yes.
You see. So. Even right now, the sanitation condition of the camp is very deplorable, and health is incorporated with sanitation. Improper garbage disposal, we don't have a proper disposal place. Secondly, we don't have proper fecal disposal. A population of 30,000, we have only like 4 public latrines, which is very minute.
Yeah.
So you see feces all around the places. So we need attention to sanitation too, good drainage system, community layout, and electrification of the community. Our electricity is not very fluent. Most of the people in the community live by manual income generating, like selling cold water, salt drinks, and minerals. But when
You're no longer being funded by the United Nations, or they picked up the tab again? You're no longer. Initially, when you started in this clinic, they gave you some small to take care of the clinic and run things smoothly here.
It was on a regular basis. That there was a regular finalized budget for the clinic.
Not just you, but some other people too, right? Worked for the UN?
Red Cross at that time. What happened usually, UNHCR gave the project to a local NGO, and they run the project. So we work in the clinic as refugee volunteers.
Yes.
We are not directly employed. We don't have insurance benefit. We don't have social security benefit and all sorts. So we are only like refugee volunteer trying to help the community. So they gave us money allowance.
But you don't see them as diabetes patients. You take care of the symptoms, but not the diabetes.
What happened is we do the initial diagnosis, the fasting blood sugar. Then after that, we make a referral to the hospital to see the specialist. Then when they have some underlying condition like infection and malaria, they come down again. We do symptomatic treatment and do a referral to the central hospital. So we know our diabetic cases here.
As I was telling them, I don't know if you heard, we just came to bring medicine for other facilities, and Joyce asked us to come here and see you. So the next time that we come, we will be bringing something, and that won't be till fall. But now you're giving us all the information, and we get to know what you need, and we will make some allowance in our next return for you also.
Thank you.
And we will stay in and we'll stay in touch. And
you
yes, that's me. Let me give my email address. Okay, let me ask you now, just AIDS. We're just talking about AIDS. We're talking about HIV and STDs. How much of it comes through here? How many patients you're seeing here?
You see, unfortunately, okay, that's the problem.
That's it.
You
Okay.
see, but we see the tip of the iceberg, and we know there's a problem in the community.
You're treating the symptoms,
but
not treating the AIDS.
Not treating. But we have, like I said, we have started to organize a group. We have trained 30 persons to work in the community. Discuss HIV should be a willing situation for them. So we'd like to ask international community to help to focus more attention in this area so that our able men and women who escaped the war can live a happy and peaceful life, to go back healthy and contribute to post-war development. Otherwise, majority of us from the camp will go back infested, and the human resources shall be depleted to develop our country.
Come on the camp. He's running the business.
We're going to interview.
Okay.
Hi, could you tell me your name and how you got here and how long you've been here at the refugee camp? My name is Andrew T. Nangbe. Um, I got here in 1990. We left Monrovia on October 10, 1990, and we arrived at the port of Tema here in Ghana on the 12th through a ship called Tana River. It was a civil war, the civil war, the rebel invasion of Liberia. When the rebels entered, it was so hard, and we lost a lot of relatives. There was hunger and chaos. There were no food, and it was just no way of survival. There was fear all over, and everybody were panicked. It was like you could die any other time, any day, any time. So, there was, yes, no way to survive. You are very hungry. You stay indoors for weeks, and you get hungry. You want to try to look for food, and you get killed. So it was terrible. So at times you remain indoors for weeks, hungry. Sometimes you have to depend on grains or tea, and at time when the tea runs out, you are forced to come out because there were many that died indoors for fear of not coming out, and they just got hungry and they lost strength and just died. And so some of us decided to, we were forced to come out to look for food because you will eventually die if you stay indoors. So why not take the risk to come out? And as it came out too, it's a danger, Yes.
So was the ship that you were on very crowded?
Oh yes, they were very, very crowded. More than 20,000 people on that ship, Tana River. It was overcrowded, actually.
How many days?
We took about 3 days. Yeah, we left on the 10th and we got here on the 12th.
So tell me what this camp was like when you came in and what you're hoping could happen for your life.
Well, actually, when we came here, we had hoped that the war would have ended earlier to go back. Like I was at the university. Yes, I was at the university.
What were you studying?
I was studying accounting and economics. Yes, yeah, and a little bit of computing. Yeah, so we thought that, okay, at least we are safe for now, though our relatives and other people are still there, the war is still raging on, but we hope that, with the intervention of the ECOMOG, the Economic Community of West African States, monitoring force, they took there. We thought the war would have ended, and then in a few months' time we'll go back to continue our lives, our education, other things. But we were wrong because it was just one war after another, and up to now we are here. It's about 13 years now in exile. Yes. At the moment, the United Nations is not supplying food. People have to fend for themselves here, and education. There are not enough educational facilities here. Skills training, and even clothing, and medical care. You have one clinic here that's even people have to pay to go to get drugs. You have to pay for drugs. If you don't have money, I don't know, you can't afford to get medical care.
So people wait till they're really, really ill before they try to get any medical care.
Yeah, it's friends that are around. Sometimes we put money together if somebody is really sick, and then we try to buy drugs and try to get that person, treated.
And what about yourself? You're educated, you're wanting to do things here. Is there any chance for you to help the situation right here in the refugee camp? Are there any organizations that are based here helping?
Yeah, well, there are a few organizations. They used to be here, but at a certain time the UN pulled out of the camp. Yes, so they wanted to even close the camp. So yes, at that time, people had to fend for themselves. Like for me, I managed to, when we got here earlier, I got a few friends around, got some money. I went to town and took advantage of some computer courses. Yes, yes. So I acquired some skills, and now I even survive on that. I tutor people in computers applications. Yes. So our host here, the host country, in fact, it's like they are tired of us here. The other day there were military presence on the camp, over 500 men. So what we will appeal to the international community is that if they could help resettle some of us, to a third country where some of us can further our education and improve our lives, you know. So it's an appeal, So if that can be done, whilst maybe medical care, food and clothing could be assisted in the short terms, then that could be a long-term plan, so that at least when when peace returns to Liberia, we can be better prepared to contribute towards the development of the country. Yes. Now, even now, if we can get people to help us, like the school, a group of friends and us are running, like I said, a computer training program. We need more computers, we need more things to, train as many refugees as possible so as to prepare them. Some of them, after the training, they can acquire a computer or printer and, start something on their own. Maybe type letters, people from the villages can come and they will earn a living. This is what we are doing. So it's an appeal that,
That's important.